Greetings and welcome to the Dr. J Vlog series. It is Friday, May 30th, 2025, and on Fridays we talk about human behavior and justifications. So in yesterday's vlog on knowledge and science, I discussed the key risk factors associated with cardiovascular diseases, heart disease. In today's vlog, I want to do a deeper dive into the social determinants of health on cardiovascular disease, or CVD for short. So unlike the strict medical model, the social determinants of health model emphasizes the economic, social, environmental, and psychosocial aspects or factors that contribute to our health and well-being, and CVD in particular. So cardiometabolic diseases cause somewhere around 5 million deaths amongst working age adults in the United States from 1990 through 2020. And more recently, the COVID-19 pandemic highlighted yet again the existing health inequities that are driven by social determinants. So for example, racial and ethnic minorities experienced the highest mortality rates during the pandemic due to various structural factors and disparities in terms of access to resources. So for example, various laws and practices exist that perpetuate discrimination and health inequities, particularly affecting cardiovascular health amongst minority populations. So for example, among other things, we've determined that racial residential segregation is linked to a 12% higher risk of CVD amongst African Americans within the United States. Also, historical redlining practices have led to ongoing segregation and associated health disparities. What happens is that segregation, among other things, reduces access to employment opportunities as well as access to quality education, all of which then further contribute to poorer health outcomes. So, and then if you talk about the neighborhoods in general, we know that the built environment and neighborhoods play an absolutely critical role in influencing cardiovascular health outcomes. Factors such as neighborhood design and socioeconomic status significantly impact physical activity and health behaviors in general. Attributes like residential density, traffic safety, and recreational facilities have all been shown to be associated with physical activity levels. Lower neighborhood socioeconomic status correlates with higher rates of incidence of CVD and heart failure. And even neighborhood greenness ends up being an incredibly important protective factor with respect to cardiovascular health, promoting physical activities and reducing stress. Even years ago, I remember reading studies about the impact of just bringing in plants into nursing homes, and how just the access or the presence of this greenery improved health and well-being amongst nursing home residents. So, of course, this has a broader impact, too, in terms of our built environments, in terms of our neighborhoods. And then there's the food environment, right, defined by access to nutritious food. And that significantly influences our dietary behaviors and our CVD risk factors. So food security and availability are crucial components that directly affect health outcomes. So access to supermarkets and healthy food options have been shown to be linked to better dietary practices and, again, in terms of reduced risk of CVD and other negative health outcomes. And so the food environments, unfortunately, in lower income neighborhoods, and especially amongst predominantly Black and Hispanic neighborhoods, often end up lacking the same level of healthy food options. That's the key. And then even things like social factors, including social support and cohesion, can directly impact our dietary choices as well. And then there are the psychosocial factors, including stress and, again, social status and things like discrimination, all of which are strongly associated with cardiovascular health outcomes. So these are the kinds of factors then that contribute to chronic stress responses that then negatively impact our health. So chronic psychological stress has been shown to be linked to increased risk of cardiovascular events and mortality. Even adverse childhood experiences significantly increase the likelihood of developing CVD in adulthood. So yes, the healthier our environments for our children will definitely and directly impact their long-term health and especially their heart health, and so on. Even subjective social status and job strain have been shown to be important psychosocial determinants of cardiovascular health. And yet we don't have standardized measures and approaches to track accurately the diverse aspects of the psychosocial factors that affect our health. In addition, then, if you delve a little bit more deeply into the connections between the social determinants and our biological responses, there are some key mechanisms that are involved here. So first, consider stress hormonal responses. So chronic psychosocial and environmental stressors activate the sympathetic nervous system, or SNS, which leads then to increased levels of stress hormones that contribute to inflammation and CVD risk. So chronic stressors then activate the SNS. That increases hormones like cortisol and catecholamines. And then dysregulated hormone levels then are linked or have been shown to be linked then directly to things like lower socioeconomic status and depression and discrimination. So, and then even our glucocorticoid receptor resistance blunts anti-inflammatory responses as well, promoting CVD progression. And so, again, long-term exposure to negative or adverse social determinants literally alters the way in which the body physically responds, the signals, the anti-inflammatory mechanisms that would normally be activated, and so forth. So again, we don't really see it so visibly, and we don't typically measure it or monitor when we do our clinical interventions, but we know that there's all of this social and environmental stuff that underlies our health as well. And indeed, this has been directly linked to various kinds of inflammatory markers as well. So inflammatory markers are significantly associated with psychosocial and environmental stressors. So things like CRP and IL-6 are linked to lower socioeconomic status and psychosocial stress. Believe it or not, the experience's persistent discrimination is correlated with increased inflammation, mediated by factors like sleep quality. And then environmental factors such as neighborhood crime and pollution are also associated with higher inflammatory cytokine levels as well. So, and then the social determinants also impact immune cell distribution and function. And that potentially influences CVD development through chronic stress-related changes in our immune responses. So all of this then has, again, enormous impacts that we don't readily see or measure typically. And indeed, for example, chronic stress is associated with increased bone marrow and splenic activity, which also contributes to CVD. Chronic exposure to adverse social determinants may lead to epigenetic changes and accelerated cellular aging, including CVD risk across generations. And then structural inequalities and discrimination can even result in DNA modifications that affect health, but we need a lot more research in this area to understand better the causal connections and the mechanisms at play. Studies do show that lower socioeconomic status in early life ends up being associated with accelerated epigenetic aging and something called telomere shortening. So the shortened telomeres at the end of your chromosomes directly contributes to aging and age-related diseases. So this is, again, a kind of a biological impact or a cellular impact that, of course, the average person, myself included, would be completely unaware of that. So, in short, we know that the knowledge of the social determinants of health can significantly improve patient outcomes. But current guidelines typically overlook these kinds of factors. So ideally, physicians and health professionals could start to update their clinical guidelines and start to standardize the use of the social determinants of health assessments. We have compelling evidence that incorporating social determinant screening into clinical practice is vital to tailoring care to patients' social needs. And that kind of an approach can enhance health outcomes and reduce disparities in cardiovascular care, especially amongst more marginalized populations. Now, if you're one of the lucky ones in this world where you have everything that's lined up in your favor, you have a lot of money, you live in a great neighborhood, and you have access to excellent health care, then that's great. You should count your blessings in that regard. But always remember, too, that there's a much bigger world beyond your front door. And so all else equal, I guess what I'd suggest is that if you could make a difference and if you could reduce human suffering, again, all else equal, why wouldn't you? Wouldn't you choose to make a difference? And again, I appreciate not everybody's going to be in the same position to do that. But look at what, for example, the Gates Foundation has been able to do in terms of reducing child mortality by supporting and funding initiatives that have focused on vaccines and improved health care and improved maternal health. So obviously we're not all billionaires. We can't do that. But I'm just proposing that we should start thinking differently about health and things like cardiovascular disease by looking at the social determinants. I think that's where we can make a huge difference. And if we do that, if we incorporate that kind of thinking into our clinical approaches, then we can improve not only our own situations, but then we can help extend the benefits, if you will, to our families and to our communities writ large. Okay, that's it for today. As ever, may you and yours continue to create peace in your lives, nurture love in your hearts, and dole out hugs in abundance. And I hope to see you again soon. Thanks for listening.